I'm Robert Seay with MB Health. I'm here to talk about Medicare Supplement and Medicare Advantage Medicare coverages. The Medicare in and of itself does not cover all the expenses that you're going to have. There's a lot of gaps that Medicare doesn't cover. In fact, Medicare every year covers a little bit less. So therefore, there is a need to have something to help fill those gaps in, so your out-of-pocket expenses aren't so much. So the two basic options is option one is the Medicare Supplement. This is where you have your red, white, and blue Medicare card, plus a Medicare Supplement, usually a Plan G as in GOAT, which is the most comprehensive coverage now. And then you also need a Medicare Part D plan, which is called a prescription drug plan, and that'll help cover those prescription drugs. The Medicare Supplement and Medicare does not cover prescription drugs at your local pharmacy. So therefore, you need the prescription drug product to go with that. The advantages of Medicare Supplement is there's no networks, no referrals, and you can go anywhere in the country to get care without any sort of referrals or anything like that. Kind of the downside to that is there is a monthly premium. That premium does increase usually every year, and then along with that, you'll have to have a prescription drug product, which is can be another company, but it'll also be a different, another premium to go on top of that, along with a Medicare Part B premium. So that's option one. Then option two would be your Medicare Advantage option, which is called a Medicare Part C or a Medicare Advantage prescription drug option. Typically, these are HMOs predominantly. They can be PPOs. The PPOs, you're going to have the greater flexibility to go in and out of a network. No referrals necessary, but your out-of-pocket expenses will be more than their HMO counterpart. HMO counterpart is going to be a little bit more restrictive, to the point of you're going to have a network of doctors that you have to see. Some of these plans require referrals, some do not. But all these plans have additional benefits in there automatically included. Prescription drug coverage, dental, vision, hearing. Most of these plans have all those included, plus some additional benefits like silver sneakers and some other nice benefits as well. They ride to and from doctor's appointments. So those are the two basic options that, as a Medicare beneficiary, you're looking at. Our job here is to help you navigate that world and try to determine, based upon your needs and your lifestyle, what is going to be the best fit.
Are there any common questions you get about supplemental coverage?
For supplemental coverage, the biggest question that often comes up is the premium. What is the premium? And the premiums are going to vary by company. Like Anthem has a premium, ARP with United Healthcare has a separate premium, but all the benefits of the plans are the same. The Plan G with United Healthcare or Anthem or Humana or Cigna or Aetna is going to be the same Plan G benefits. Some of the plans have some additional side benefits, like silver sneakers, discounts for a variety of things. Those are more just side benefits, but the actual core structure is there. The other question I get is I don't take any prescription medications. Do I still need a prescription drug plan? Well, that answer is yes, because if you don't get a prescription drug plan when you should have gotten into one, then there will be what's called a late enrollment penalty, which is 1% of the national average premium at the time you enroll, and then 1% for every month thereafter. So after like 5-year period, that's 60%. And right now that average premium is about $40-ish a month, and that usually goes up more or less every year as well. So in 5 years, that could be $50, $55. 1% of that is 60%. It could be a number. So that's why we say it's important, even if you don't have any prescriptions, to get into something. The cheapest plan available, just something. The other question, another common questions I have is more on the Medicare Advantage option. These Medicare Advantage options either have a zero additional premium, or a low premium. That's in addition to Medicare Part B premium. You're always going to pay that, regardless of the option you choose. But the biggest question I get is that how can these insurance companies give me all these benefits for a zero premium? The point is, Medicare gives these insurance companies a set amount of money per member per month. People ask me, well, how much is that money? And that's proprietary information. It's not disclosed, but it is obviously it's significant enough because there's a lot of competition in this area to warrant pursuing that as far as offering that coverage. The other thing is the referrals, questions, prescription drugs, all that. But when we sit down face to face, I go through all those benefits and all your questions, and then in whatever decision you come up with, as far as it's going to be your best decision, then my job is to help you feel comfortable in that final decision.
Okay, I got one question. So earlier on, you mentioned, was it Plan G, where all coverage was basically the same? Mm-hmm. The only difference was premiums.
Right.
Why would someone ever pick one that wasn't just the cheapest plan then?
Well, that's a great question. Sometimes people have a particular affinity to one company like United Healthcare because their grandparents or their parents had United Healthcare, and they want United Healthcare regardless. Some people just think, I've had a bad experience with Anthem or a bad experience with X. I don't want X, but I don't want the Medicare Advantage option either. So, point is, it really just comes down to customer service issues as far as that goes, and their preference. Usually, I will direct people to the cheaper option as far as that goes. Now, if they want to see other options and the other premiums, I have all that handy and at my disposal. So if they have a particular, affinity one toward the other, they don't like Anthem, they don't like ARP, they don't want to have to join ARP or whatever, then there's other products that are available. And they're all reasonable price in a general ballpark area.
Okay. And then one last question. What do you wish more people knew about supplemental coverage?
One of the things that is necessary for people to know is the fact that they still need a prescription drug plan, that it does not cover prescription drugs. The supplement does not cover prescription drugs at all, not at the pharmacy level. And it's an important piece of your Medicare coverage.